Hello, my name is Dr. Martin Bales, and I've been a practitioner here at Cancer Center for Healing and Center for New Medicine for over a decade, coming up on 11 years. Today's topic is breast cancer detection options, and it's a good time to talk about it because we are already in October, if you can believe that, of 2020, and October is Breast Cancer Awareness Month. So what options are there available right now to women for breast cancer detection? I'm going to talk a little bit about three different. I'm going to talk about thermography, mammography, and ultrasound, and the pros and cons of each. So I'll start with thermography. It's near and dear to my heart because my father actually invented the first digital infrared camera in 1979. He did not invent thermography in general. They've been using thermography for military purposes as far back as World War II, but it was in a film-based or analog format. So making it digital made it a lot higher resolution. So how does thermography work? Well, first of all, it's FDA approved as an adjunct to mammography, and it uses a special heat-sensitive camera to detect minute temperature variations in the breast. It can also be used for inflammatory and pain conditions anywhere in the body, but today's topic is breast, so we'll go there. All cancers, not just breast tumors, have more heat. They emit more heat than surrounding tissue. So thermography works by differentiating more of this emission of heat than what normal tissue is. That's how it works. It's non-contact. There's no touching. There's no pain. No pancake smasher, and it's non-invasive. No opening the skin or anything, and it's completely safe. There's no radiation, so it can be performed as much as needed. So using thermography is a great screening tool. Now, thermography is a physiological imaging. It's not structural imaging as with mammography or ultrasound. So they're different. So there's no way to say one's necessarily better than the other. In fact, one study found that combining all three proved an accuracy of 97% detection, which is really, really high and really good in the medical world. So using them together is very advantageous. We like to think of using thermography as a screening. And if we get an abnormal thermogram, yes, it could be cancer, but there are other breast diseases like mastitis or adenoma or fibrocystic breast, so it could signal that. So using thermography as a screening, and then we go on to other modalities. So those are the benefits of thermography, and the drawback being that it's not specific. It just says something's wrong. We don't know exactly what it is. So moving on to mammography. Mammography uses an X-ray to see differences in density because tumors are more dense than surrounding tissue in most women. Now, women that have dense breasts, that's not necessarily the case, so that's one drawback of mammography. Also, it does use some radiation. It's gotten a lot better as it's gone digital through the years, and there is the contact, the smashing down, which, as I've heard, is not the most comfortable. So mammography is a great way to actually see. It can actually see a tumor if it's not in too dense a breast, and you can actually measure it, whereas thermography, you can't do that. Ultrasound was first introduced around 1980 and has gotten better and better through the years. I like it because it is contact, but it doesn't use any radiation, and it can see different tumor structures. So it's structural imaging, just like mammography. Here at the center, if we do have an abnormal thermogram, it's very easy because we also offer ultrasound services, and we can take a quick ultrasound to look in the area of interest what came up on the thermogram. So the breast thermography is fast, it's safe, it's pretty readily available, and it also is perfectly fine for lactating women and also women that are pregnant. It's specifically beneficial for the younger population of women who tend to have more dense breasts. More dense breasts makes it easier to miss a tumor on a mammogram because the tumor density and the density of the breast are the same, so it's hard to differentiate. In addition, here at Cancer Center for Healing, we can use these modalities, thermography, mammography, and ultrasound, to create a personalized treatment plan for someone that has already contracted breast cancer. These modalities can track progress of our treatments over time, and as I mentioned before, thermography could be done anytime because it doesn't emit any radiation to track the vascular pattern that's associated with the tumor and hopefully see that decreasing. And we can also offer ultrasound here to also see that the tumor is hopefully shrinking. This is October, it's Breast Cancer Awareness Month. We want to make everybody aware of the benefits of all these imaging modalities and how they can be used together to ultimately save lives. Thank you so much.